In the previous video, we talked about caries prevention oral health promotion programs and really focused on the variety of fluoride programs that are out there in addition to the sealant programs that are out there and the pros and cons of each. In this particular video, though, we're going to talk about other oral health conditions and the oral health promotion programs that center on those particular conditions, such as periodontal disease, oral facial injuries, and oral cancer. And where do we go from here? Because I think that you'll see, compared to the caries prevention programs that are out there, this particular video, you'll see the prevention programs that focuses on these particular diseases are very much lacking, and we have a lot of growth that we can do in these areas. So let's start with perio prevention oral health promotion programs. So really, oral periodontal disease prevention programs are very, very, very limited. And it is limited basically to school-based programs that focuses on proper oral hygiene care at home in terms of brushing, how to brush appropriately, and even flossing. So it's not only are we providing education in these periodontal disease prevention programs, we could also kind of promote and change policies in terms of providing toothbrushes within the classroom in hopes that the school system will adopt a program where the kids are brushing their teeth every single day at a certain time. But we'll talk about the problems that are associated with that. But typically, school-based programs are education-based, and they really occur very infrequently. And they're typically not comprehensive because they do occur very infrequently, and it's outside professionals that are typically coming in during like Children's Oral Health Awareness Month, which is February, and doing a one-time education program instead of doing something on a daily basis in talking about oral health. The advantages of doing these school-based programs, though, is that it does raise awareness of dental health. And then hopefully the thought behind that is that if you teach the kids how to take care of their oral cavity appropriately, hopefully they'll turn to good habits, and they'll keep those good habits throughout their lifetime. And then if they're keeping good habits, then it will impact their children that they might eventually have later on. And so hopefully it will break a cycle of improper oral health care. And unfortunately, this might be some of the only contacts that some kids will have with dental professionals. So hopefully it will build rapport, and it will alleviate some fears that kids might have with coming to the dentist and seeing dental professionals. So hopefully you can make a connection with these kiddos and ensure them that a dental office is not a super scary place for them to be going, and that those people really care for them, and that they need to get their oral health taken care of. Some disadvantages of this particular program is that it can cost a lot, or it could cost very little. It really depends on exactly what you're doing. If you're just doing education, then it could cost very little, relatively inexpensive. But if you are trying to implement a toothbrushing program within the classrooms for every single day, that could definitely build upon the cost. There's not really a whole lot of research out there that talks about the effectiveness of this approach in terms of just educating or doing a toothbrushing program. So we don't really have the evidence that backs up these types of programs. If you're trying to do a toothbrushing program within the classroom, teachers get a little bit anxious about this. They don't really love the idea, and it's simply because that can be a very disruptive part of the day as well as messy. And you have to think about all the details. Is there a sink within the classroom? And if there is a sink within the classroom, how are you going to get each individual child to that sink to do the toothbrushing at the appropriate time and for the appropriate amount of time? Or if there's not a sink within the classroom, are they going to spit into a cup and use paper towels to wipe up any remaining spit? Or are you going to line them up and then take them down the hallway and go into the restrooms with them? So it really brings up a whole lot of issues, other issues that you have to think through. There can be a lack of area to store supplies as well. So if you're implementing a toothbrushing program within the classroom, you have to store those toothbrushes appropriately so that they're not getting cross-contaminated and whatnot. So you have to kind of build that into your plan of where you're going to store those within the classroom, and take up some valuable classroom space as well. So that's it. That's all we have for oral health periodontal prevention program. So we do have a lot that we can expand on there. And it's going to take people that have very creative minds to be able to really kind of develop periodontal disease prevention programs. And it's much needed within our society. And you can see that with the epidemiological numbers that we talked about in a previous lecture. So let's move on to other oral diseases and issues and talk about the oral health promotion programs that are out there for those. The first one that we're going to talk about is injuries, oral facial injuries. And there are several more different programs that are out there for oral facial injuries. And hopefully the dental and dental hygiene professions and the professional associations are actively supporting this and these programs that are out there that have been developed by other agencies like the CDC or even Mothers Against Drunk Driving and some other agencies like that. So we could definitely be very transparent in our support of these types of programs. So the first one is drinking and driving. So, we have a lot of oral facial injuries that happen whenever people get in accidents, whenever they're doing and drinking and driving while they're intoxicated. So we want to definitely prevent that. So one of the campaigns that just recently came out was a TV ad spot that was featured during the Super Bowl a few years ago. So let's play this video so that you can see that particular campaign that was developed, and it was actually developed by Budweiser, an alcohol company, so to help prevent drinking and driving during Super Bowl time. So I love that video, and I think it's because that puppy reminds me of my Bailey girl. So I always feel a little connected with that particular TV commercial, and hopefully that TV commercial has impacted other people on and kind of hit them in their emotional core, because I think that's where it really is beneficial. And I think that's what the Budweiser company was trying to do there, is to hopefully make people aware that there's other people that are depending on them, or other beings that are depending on them, and hopefully they'll come home safe. Some other programs that are out there, seatbelt and child safety seat programs. I know when the twins were born, we couldn't leave the hospital until we had their car seats inspected. and that they were ensured that they were in the car appropriately. Some of the firehouses that are around town will actually put in your car seats and, make sure that they're put in there appropriately and to enhance all the safety features of the car seats. There's also bicycle helmet programs that are out there that are very, very good. So we've definitely seen an increase of kids wearing helmets while they're, on their scooters or riding bikes around town. I've even seen adults riding with their helmets around the parks and whatnot, which is really nice to see. Hopefully, they're protecting their noggin there. I don't think that bicycle helmets were at all the rage whenever I was little. I never wore one whenever I was riding a bike whenever I was little. So it's really nice to see that has really kind of come along. And in fact, a few years ago, the U of L Physicians Group, which is right next door, two doors now, they partnered with two other organizations, and they raised awareness by giving kids at Portland Elementary, every single child that got in that particular school got bicycle helmets, which was great. One thing that I do think that dental and dental hygiene professionals do a really good job at is the mouth guards for sports, and really kind of advocating for the use of that. And that's really in our wheelhouse because we're really trying to preserve that oral cavity specifically. And then the final oral facial injury prevention program that's out there is really kind of centering on fall preventions. And so they're really kind of targeting the geriatric community here in terms of building in equipment that will help prevent falling, such as handrails or non-skid floorings and bathtubs, and just really trying to eliminate some of these hazards that could be a falling hazard for people that have more limited spatial awareness as well as mobility. Oral cancer prevention, we're doing better at oral cancer prevention promotion programs, and while we're doing better at that, there's still a lack of public awareness regarding oral cancer and how deadly it can be and what are the signs and symptoms. So we really need to enhance our comprehensive education on oral cancer, and we need to talk to the public about the risk factors for oral cancer, what to look for. We need to raise the public's perceived need about coming to the dentist, even if they're a dentist, and then coming in and getting oral cancer screenings at least once a year. Not only do we need to educate the public, we need to actually be a little bit better in terms of healthcare providers. And I'm not saying just the dental hygienists and the dentists need to be better, but the medical part needs to be a little bit better as well. Yeah, we can all do oral cancer exams. We can all do tobacco cessation. So all of those things are within our wheelhouse, and it's not something that should just be a dentist or a dental hygienist role. Some of these people are not coming to see the dentist or the dental hygienist, especially if they have a lack of perceived need. So we really need the medical professionals, the nurse practitioners, and the doctors to really kind of take on that role as well. It never hurts to have a second or a third pair of eyes on something. And then if a healthcare provider that's not a dentist or a dental hygienist has questions, then they can refer to the dentist, or they can refer to the oral surgeon and have that biopsied. So this is a particular commercial that the CDC developed a few years ago, And they actually had this whole campaign regarding tobacco cessation. And this one in particular stood out to me. And this particular lady, her name is Terry, and she has since passed away, but she was featured on several of the commercials that the CDC developed. And she talked about her journey with tobacco, and you'll see that here. So, unfortunately, Miss Terry has since passed on, but her legacy lives on through this commercial and these campaigns that the CDC developed. She wasn't the only one that was featured in some of these commercials, but for some reason, she in particular sticks out to me in her journey. We also have oral cancer health promotion programs that start as early as third grade. So we have some school-based intervention programs. So in elementary school, we're already talking to those kiddos about cigarettes and spit tobacco and other forms of tobacco at this point, like the Juuls and the hookah and all that type of stuff. And we continue to do that through middle school and high school and talk to these kids in hopes to prevent them from even starting a tobacco product. So we have developed some school-based intervention programs there. If you were to develop a school-based intervention program that focuses on tobacco cessation or tobacco in general and oral cancer, and you want to involve everybody that's within that school. You want to involve the teachers, you want to involve the parents, you want to involve the administration. But the most important population that you want to involve are the students themselves. You want to get feedback from them, especially in a needs assessment, so that you can make your program as targeted to their interests and their likes and their wants and their needs as possible. So I know that people sometimes are dismissive of students and asking them their thoughts and their opinions, especially older middle school, high schoolers. But it's really important that you get feedback and involvement from the students. And peer pressure is a great thing. So if you can involve the students, then maybe there can be some peer pressure aspect as well to it. We have been doing some oral cancer screenings in high-risk populations all along. In Kentucky specifically, U of L has partnered with Kentucky Cancer Program, and they have done oral cancer screenings at the state fair for more than 20 years. It's kind of the availability of the oral exams is not 24/7 at the state fair, and in recent years I've almost seen a decline in our availability to be able to do those oral cancer screenings, and I don't know the reason behind that, but we are still present out there, and typically during like high traffic times like Friday night or Saturdays or Sundays to do these oral cancer screenings, and they're completely free. They are typically staffed by like Dr. Furiello, does them quite a bit, or some of the other DMDs that are at ULSD, and some of the dental students go and they do these oral cancer screenings for the state fair goers. And some other things that we can do is we can really kind of target the tobacco industry, and especially the tobacco sales to minors. So we can really kind of enhance the policies that are already there to hopefully decrease tobacco sales to minors that will eventually get them hooked and habitual tobacco users. So we could not only enforce these policies and these laws and really kind of increase these fines associated with breaking those laws, but we could also educate the merchants that are out there, the gas stations, and the Krogers of the world. And then if we make tobacco products more costly and we tax them a little bit more, then that might be a little bit more prohibitive for minors as well. Maybe it will put it out of their price range. That's the thought behind that. So where do we go? Where do we go from here? As you can see, the periodontal disease prevention, the oral cancer, the oral facial injuries, all of those are not quite as developed as our caries preventions program. So we have a lot of different avenues that we could go, and we have a lot of work to be done, honestly. So we need to educate the public. And not only do we need to educate the public, we also need to educate some other healthcare providers as well, but we'll talk about them here in a second. So we need to educate the public. Remember that when we have the need that's out there, we know that the need is out there, and we educate the people and we create an awareness, we're creating that potential demand, which is that desire to get care. So if we educate the public, we can hopefully bring people within our dental offices and our clinical practice. So we could educate them on fluoride and the mechanisms of action of fluoride and how it prevents decay and the statistics behind that. We could talk to them about sealants. We could talk about how sealants are very beneficial to especially low-income kids and preventing caries. We could talk to them about periodontal disease and how to forestall periodontal disease. And once periodontal disease starts, what are some things that we can do? We can really educate the importance of fluoride for adults too. So it's not just a kid thing. So, we can hopefully advocate and increase the population that's getting fluoride, because remember, remineralization is the most beneficial aspect of fluoride. And who needs remineralization mainly? It would be people that are adults. We can also talk about oral cancer and coming in for routine oral exams, especially for the edentulous. So we're, getting people to come in and at least touch base with their dental provider. We also need to educate providers, other healthcare providers, as well as dental providers. And we are educated during school on some of these things, but we need to take those practices that we are educated about in school and actually implement them in our clinical practice once we graduate. So some things that we could really do is, we could really increase offering fluoride, not only to kids, but to our adult patients as well. And that's not just a dental thing. Healthcare providers, other medical providers could also do that within their family practices. We could talk about oral cancer and the risk factors. We can't shy away from those difficult conversations of tobacco cessation. We need more Celeste Worths and Pam Temple Jennings of the world to Celeste is Pam's counterpart over at the Kentucky Cancer Program. So we need more of those people in the world to go out and spread those messages of tobacco and how it's related to oral health. And we can do that. That's definitely within our wheelhouse. We can do that. We need to do oral exams by all medical professionals, especially if a patient is not coming to a dentist or have a dental home. Then other medical professionals need to do those oral exams. But we also, as dental providers, we need to be telling our edentulous patients, our denture patients, that they need to come back at least once a year and get a quick oral exam. And finally, I think I've hit this a couple of times, but we really we really need to emphasize the systemic oral connection a lot better. You know, in the past, it was the dentist do the mouth and the medical doctors do all the other aspects of the body. But we really need to integrate those. And we're doing better at this, but we still have a ways to go, obviously, and we can still work at it. So that is all the oral health promotion programs that are out there, um, that are commonly out there. There are other ones that are implemented here and there, but these are the ones that are the most common. So um, you hopefully you're the future of our profession. So hopefully something in this particular section has maybe started your thought processes of how we can go about increasing and bettering some of these programs that are out there that are specifically lacking. So here's your exit ticket information. Go to that website that you've been going to, and the room name is CDH1 Lecture 9.